Just drop it from the top, Jasmine. You want me to do it?
Yeah, you
All right, so
much pressure.
we'll start with the arteries and kind of work our way out. Obviously, this is the heart here, right? So we can take some of this off of the heart. You still have the pericardial sac there. But here's your aortic arch. Coming off of the aortic arch on the cat, you're only going to have 2 vessels as opposed to 3 in the humans. Here you have your brachiocephalic trunk and your left subclavian artery. If we follow the brachiocephalic trunk under the veins here, you should see 3 branches, which you may have to do a little bit of cleanup there to see those. But these branches are going to be your right subclavian, right common carotid, and the left common carotid. Right? And so those are the 3 branches coming off of that brachiocephalic. If we follow the right subclavian artery, eventually that would exit the rib cage and become the right axillary artery. And then as it gets into the brachium, right there, that would be your brachial artery. If we go straight to the left subclavian here, that left subclavian is going to come out of the rib cage. As it passes out of the rib cage into this region, the axillary region, that's where it becomes the axillary artery. And again, you still have a lot of connective tissue here that's binding it all together. You guys might have to clean that up.
Jasmine was supposed to clean that up.
So there it is right there. Axillary artery. And then again, once you get into the brachium here, it gives rise to the brachial artery, which is right there. As far as the veins, you have the brachial vein making its way back. As it moves into the axillary region, it becomes the axillary vein. Once it goes into the rib cage, very brief segment here, I mean tiny. This is going to be your left subclavian vein, and then that drains into the brachiocephalic vein. On the right side, you see the brachiocephalic vein as well. And those 2 brachiocephalics then drain into the superior vena cava. Draining into that superior vena cava, you're also going to see the azygous vein. Right. So that's the azygous, which is draining all these intercostals. So the azygous then comes in and drains into the superior vena cava. Right. So those are the main vessels that you're going to see here. Remember the jugulars, as we follow out the external jugular and internal jugular, the internal and external carotids. You want to look at the pictures that are on the cabinet over there. The last one to consider here is if we follow the aortic arch as it turns down and becomes the thoracic aorta, that's going to be that large vessel that you see here. Right? And then that's going to make its way into the abdominal cavity, where branching off of that abdominal aorta, which you can kind of see right there, right? The first branch that you're going to see here is the celiac trunk. I remember that celiac trunk is going to supply the spleen, the stomach, and the liver. Right? So there's your celiac trunk. Here's the superior mesenteric, which would be the next one, supplying the small intestines and the mesenteric arteries. As you continue to make your way down the abdominal aorta, the next branch that we're interested in is going to be the renal artery, which you can see right there, supplying the kidney. Continuing down from there, the next major branch would be the, in this case, male cat spermatic artery. Right, you can see the artery branching off of the abdominal aorta here. Right? And then finally, the last branch of the abdominal aorta that we're concerned with is going to be this inferior mesenteric that's supplying the colon. And as you proceed to the caudal end from there, you see that the abdominal aorta splits into left and right external iliac arteries, and then right and left internal iliac. Right? So I think I said it backwards the first time, right? So left external iliac, right external iliac, right internal iliac, left internal iliac. If you follow the external iliac, that exits the abdominal cavity and eventually gives rise to the femoral artery here. If we follow the veins back, we have our great saphenous vein here along the superficial aspect of the medial knee. That's going to drain into the femoral vein, which is this guy here. Right, as the femoral vein goes back into the abdominal cavity, it drains into the external iliac vein, right, which is that vein that we're seeing here, very deep. Right? Now there is a branch right there where the probe is kind of hooked, right there. That branch is where the external iliac vein and the internal iliac vein, which is deeper, come together. Right? Once they come together, they drain into the common iliac vein, which is this guy right here. Now it's a little bit more superficial. If we continue to kind of clean this up, and you can see where those two common iliac veins will then drain from the left and right side, come together to form the inferior vena cava, right? or drain into that inferior vena cava. As far as the branches, besides that, you have your, on the left side, you have the renal vein draining into the vena cava. And then if we go back to the spermatic vein, this is the vein going down to the, or coming from the testes. This one actually drains into the left renal instead of draining into the inferior vena cava. But on the right side, the spermatic drains right into that vena cava. Oh, wow, look at that. You can see it right there. So right directly to the vena cava. On the left side drains into the renal, and then the renal drains into the vena cava. And then those are the only two main branches that we're going to see here that we're concerned with. Right? That's it. Good. This is a good cat. What's the name on the bag?